Welcome to Provent Therapy. Provent Therapy is clinically proven to treat obstructive sleep apnea. Provent Therapy works by increasing pressure in the airway when you breathe out, which helps prevent collapse of the airway while you sleep. That pressure is telling you that the device is working. It may take some getting used to. The device works by making it harder to breathe out through your nose, which helps create the pressure needed to treat your obstructive sleep apnea. This may feel uncomfortable at first, and it may take up to a week or longer before you feel comfortable breathing with the device. This is normal. Remember, sleep apnea is a serious, lifelong medical condition that should be treated. Although it may take time to get used to wearing Provent Therapy, consider the positive benefits of treatment. This video will help you get used to wearing the Provent device before and during sleep. Provent Therapy is a disposable device that attaches with a hypoallergenic adhesive over the nostrils. The proprietary microvalve technology uses a person's own breathing to create expiratory positive airway pressure, or EPAP. During inhalation, the microvalve opens, allowing for nearly unobstructed airflow. Then, during exhalation, the microvalve closes, partially restricting airflow to create EPAP and maintain pressure in the airway through the start of the next inhalation. This helps keep the airway open during sleep. Correct placement of the Provent device is critical. Follow these instructions to ensure a good fit. Just prior to going to sleep, remove each device from the white card by grasping the tab and peeling it off. Start with a clean, dry nose. Using a mirror, align the mesh part of the device with your nostril to ensure correct placement. Point the tab on the adhesive up towards your eye. Apply and press down gently on the adhesive to create a seal. Stretch your upper lip downward as when shaving. Check for a proper fit. Make sure that each nostril is covered with the device. Run your finger around the adhesive of each device to make sure there is a good seal. There should be no air leaks. Put on the Provent devices right before bed and breathe through your mouth while you fall asleep. Most people will switch to nasal breathing after they fall asleep, and the device will start working. It is important to remember the following when you are getting used to breathing with Provent Therapy. The device works by making it harder to breathe out. This creates pressure in your airway and helps keep your airway open. Breathe out through your mouth when awake. Do not try to breathe through your nose when awake. This will naturally happen when you fall asleep. If you wake up feeling uncomfortable, just take it off. Try it again tomorrow. It may feel uncomfortable, but give it up to a week or longer. It should get better, and you should get used to it.
The adhesive doesn't seem to stick to my nostrils.
Ensure the area around your nostrils is clean and dry before applying the devices. Remove any lotion or makeup from the nostril area and dry completely. If you have a mustache, you may need to trim around the nose to ensure a good seal.
I have trouble applying Provent correctly.
To make it easier to properly apply your Provent devices, ensure that you always use a mirror during application.
Wearing Provent at night makes my mouth dry.
It's a good idea to keep a glass or bottle of water next to your bedside in case you wake up with a dry mouth. Remember, sleep apnea is a serious, lifelong medical condition that should be treated. Although it may take up to a week or longer to get used to wearing Provent Therapy, remember that treating your sleep apnea is an important step towards better sleep and better health.